Okay. Hello, good afternoon, everyone. My name is Juliati, and I am a community pharmacist working in Watson's. Welcome to another session of Watson's Facebook Live, Ask Our Pharmacist. Today, I'll be sharing on a topic that has become more common and is on a rising trend recently, which is dengue fever. As usual, if you would like to listen to our previous sharing, you can find them under the video tab of Watson's Facebook page. And should you have any questions along the way during this presentation, feel free to leave them as comments and I will address them at the end of this sharing. The agenda for today's sharing will include the definition of dengue fever, and mode of transmission of dengue fever, signs and symptoms of dengue fever, and some warning signs to see doctors, management of dengue fever, and lastly, some measures to protect ourselves from getting dengue fever. So, what is dengue fever? Dengue fever is a mosquito-borne disease that is caused by dengue virus. In total, there are 4 types of dengue virus. So one can get infected up to 4 times in his or her lifetime with different dengue virus. Dengue fever is usually self-limiting, with most people recover within 2 weeks. But in rare cases, more serious form of the disease can lead to a life-threatening complications such as dengue shock syndrome and dengue hemorrhagic fever in some people. Up till date, the total number of dengue cases in Singapore is almost close to 3,000, and dengue virus type 3, it has been detected as majority of the dengue clusters. According to today's report that was published 2 days ago, our Ministers of State for Sustainability and Environment, Mr. Desmond Tan, mentioned that the sharp rise in the number of dengue cases in recent months is very worrying. And just last week, a total of 444 dengue cases were recorded. And this is the highest number recorded at this point in time in the last 4 years. So how does one get infected with dengue fever? Dengue is transmitted from the bite of an infected Aedes mosquito after it takes a blood meal from a dengue infected person. It can also be transmitted through mother to child during pregnancy and also from contaminated blood products. Thankfully, dengue fever is not contagious and does not spread directly from person to person. Signs and symptoms of dengue fever usually develop within 4 to 10 days after being bitten by the infected mosquitoes. They generally include sudden high fever that's more than 40 degrees Celsius that lasts for 2 to 7 days with at least 2 of these following symptoms: headache, pain behind eyes, nausea and vomiting, swollen glands, joint, bone or muscle pains, and skin rashes. If you think that you have dengue fever, seek medical attention early. Kindly note that it's also possible for someone to have dengue fever and not look ill or have relatively mild symptoms. Bear in mind that there are some warning signs that should prompt you to seek immediate medical attention, such as abdominal pain or tenderness, persistent vomiting or persistent fever, no urine output for 4 to 6 hours, sign of bleeding, can be under skin, nose, gums, blood or bloody tarry stool, or blood in the vomit. Feeling very tired, dizziness, restlessness, and altered mental state. In severe dengue, hospitalization and aggressive emergency treatment with fluid and electrolytes replacement and/or blood transfusion may be necessary. Those at greater risk are people with weakened immune system and those with second or subsequent dengue infection. There's no specific medication to cure dengue, with most options given is just to control the symptoms. Depending on the severity, hospitalization may be required for further observations and management. Tips for dengue fever management at home include get plenty of rest, drink lots of water and stay hydrated. You can take paracetamol for pain and fever, but avoid aspirin and non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen due to an increased risk of bleeding. If you are on this medication, seek your doctor's advice. You should also minimize intensive activities that can increase risk of injuries and unnecessary bleeding. You can avoid brushing teeth or blowing nose if you are diagnosed with low platelet count. There are some protective measures that you can take to protect yourself and minimize spread of dengue. Do the mosquito wipe out at least once a week to prevent the mosquito breeding. Stop dengue with block. Break up hardened soil. Leave and empty flower pot plates. Overturn pails and wipe their rims to minimize water collection. Change water in vases regularly. Keep roof gutters clear and place BTI insecticides. On top of the block mosquito wipe out as mentioned earlier, remember to also spray insecticide in dark corners around the house. Apply insect repellent regularly, especially if you are going outdoors. Wear protective clothing such as long sleeve tops and long pants in the day. Let's talk about insect repellent now. Here is a table mentioning a few ingredients that you can find from some insect repellents that are sold over the counters. Insect repellent containing DEET are the most effective and has the largest spectrum of coverage. Picaridin at a higher concentration of 20% has similar efficacy to DEET, but a shorter duration of action of about 5 hours. IR3535 is less effective than DEET and picaridin, and citronella-based containing insect repellents is the least effective amongst these options. When used as recommended, insect repellent are safe to be used for children as young as 2 months old, except for some due to the lack of evidence. Insect repellents may come in various forms over the counter, such as patch, spray, or roll-on for convenient use. In order to use insect repellent safely, remember to always check the product label and use it according to the manufacturer's instruction. In general, apply just enough repellent to cover exposed skin and/or clothing, and make sure that you wash the treated skin with soap and water upon returning indoors. You can apply sparingly around the ears, but try to avoid the eyes and mouth areas. Do not apply repellent over cuts, wounds, or irritated skin. If you are applying the insect repellent for your child, spray it to your hand first and then apply it onto your child or to their face. For mosquito repellent patch, Stick it to the clothing and not directly onto the skin. Lastly, for those who had a previous episode of dengue infection, getting a dengue vaccine can be considered to lower the risk of potentially more severe dengue infection, a subsequent dengue infection. In Singapore, dengue vaccine is approved for 12 to 45 years old of individuals who with a confirmed prior dengue infection. This dengue vaccine, however, is not recommended for those without prior infection, as study has found a higher incidence of severe dengue infection following vaccination. In conclusion, the best preventive measure to protect against dengue is to control the breeding of mosquitoes that carry the virus. Feel free to speak to your pharmacist if you need more information on dengue, or check out National Environment Agency website for more dengue updates. When going outdoors, remember to apply repellent regularly and follow the directions of use closely. If you think that you have dengue fever, seek medical attention immediately for early detection and supportive treatment. We have come to the end of my sharing, and let's see if you have any questions from the floor. Okay, I see there's one question from Ong. Can I use both insect repellent spray and patch together? Is it better? If let's say, okay, most of the patch actually contains citronella based products. So if you want to use them together, I think there's no harm. But then I would suggest that you can still just use, for example, if you use a DID containing product, since they give a longer protections, may not necessarily you need to use the patch anymore. But yes, you can still use them together. As of now, we only have one question, but I will share with you some of other questions that I often get during working as a community pharmacist. Which should be applied first, sunscreen or insect repellent? The answer is you should apply sunscreen first. After using the sunscreen, apply insect repellent 15 minutes later. For this containing insect repellent, they may actually reduce the efficacy of sunscreen. So you may find that in the market, there are some big containing sunscreen, but they already account for in such interaction in their formulations and require reapplications. Products that contain both DID and sunscreen are not recommended for children because reapplication may be necessary for the sunscreen component, but this reapplication may result in an excessive exposure to DID for the children. Can you use multiple insect repellent patches at the same time? Yes, you can. Multiple patches may be recommended for children and adults who are larger in size due to their larger body surface area. Remember to stick it to the clothing and not directly to the skin. Can pregnant ladies use insect repellent? Study has found that DID containing insect repellent is safe during the second and third trimester of pregnancy. If need to apply during the first trimester, try to spray onto clothing instead of the skin to minimize the absorption of the DID containing insect repellent. Wear protective clothing when going outdoors as much as possible. And when in doubt, consult your doctor for more clarification. Let's see if we have any more questions from the floor. Okay, I think we don't have any more questions at the moment. So we have come to the end of the presentations today. And I hope that you have enjoyed and learned something from today's sharing. If you have any more questions, feel free to leave them at the comments, and I will be here for the next 3 hours to address your questions. Thank you and have a nice day, and I will see you at the next Facebook Live. Bye-bye.